Hey everyone, my name is Dr. Ashley Reed. I'm a developmental psychologist and I'm the director of early childhood mental health services at the Institute for Girls Development. I'm getting ready to go for a walk with our CEO, Dr. Melissa Johnson, to go get some coffee and talk a little bit about an upcoming CEU training that we have about how to work with children who have chronic illness or pain. I thought I would bring you along for the journey so that you could hear a little bit more about the type of work that we do and what we're so passionate about. Let's go. Hi, Dr. Melissa.
Hey, Dr. Ashley.
Thought that maybe while we walk to coffee, we could talk a little bit about our work with kids who have medical conditions.
That's fantastic. I love that idea.
Okay, Dr. Melissa, so maybe while we walk, we can talk a little bit about the type of work that we do with kids and their families and why it's so important to us.
My why starts professionally back in the mid-1990s. It was the height of the AIDS epidemic. I specialized in working with women and children with HIV. In the years since then, I've really expanded the work that I do with children, teens, adults, around health conditions and chronic pain and procedural pain. One of the things that I truly value is being able to share science-backed information with families that can be so empowering, not just for the children and the teens, also the family as a whole.
What's one thing that providers ask you the most often?
Probably the most frequently asked question that I get for consultation is, how do I think about effective, ethical, competent ways to address mental health related concerns for the kids that I work with health conditions or procedural or pain management concerns? Most of us, if not all of us, have those kids and teens in our practice. At least 2/3 of children and teens having a fear of pokes, vaccines, shots. There are science-backed mental health intervention that can be provided. I love sharing and empowering other mental health professionals along these lines.
One thing that providers also typically want to know, how does chronic illness affect a child's mental health?
We know from the research that medical trauma and medical stress in childhood and the teen years can result in adults having more difficulty accessing medical services. Not only does stress and trauma in the early childhood and teen years affect mental health, it can also affect physical health across the lifespan.
Can you give us maybe one small thing that you've recommended to providers or to families to help their kids in coping with pain or trauma?
I love to talk to families about what I call the 3 Ps: pause, presence, and plan. We live such busy lives, we may not take the time to pause and be present with our kids before these appointments. Also might be wanting to avoid a meltdown or additional distress for our child. And yet, we are present and calm. We can actually help our kids with greater control and greater comfort. And that's what we really want, our kids and our families to be able to have a sense of comfort and control, sense of safety in navigating the medical system.
I was thinking something similar.
Uh-huh.